the last session of this wonderful conference, and we will open this last session with a very important speaker, with Helga Rohra, and she got the diagnosis of dementia, and she's a great advocate for dementia patients and their family, and she has a special request for you.
My topic today is nothing about us without us, involving people with dementia. I am Helga. I've got diagnosed about 5 years ago with a dementia of Lewy body type. If I talk about my life, I remember that was me, this is me, and this is me today is a combination of what I was and the new deficiencies I have to cope with, and finally this is me. But this person is still Helga, with a diagnosis or without. My job was an interpreter. When I'm looking in the back in that booth, I remember the best time of my life. I forgot a lot. I still speak English and German. But I remember the good time of my life, and I'm not crying about all the other languages that are blown in the wind. Finnish, Italian, Spanish, French, the wind. The wind took them away. But there are still a lot of capabilities. And I'm here today to speak about our still existing capabilities. After getting diagnosed, the most important fact for a person is the diagnostic help. We can't be left alone. We need, at the beginning, the human support. We need someone who listens to you, who tells you you are not alone. First, humanness, and then all the other programs, inclusion, and whatever they are called. I was lucky, as all my friends sitting here. We got a leaflet from our neurologist, and it said on it, Alzheimer Society, Gesellschaft München. That's a place where I belong to, Alzheimer Gesellschaft München in Germany. There, I started from the very beginning with my self-supporting group. At the beginning, I became a member. And in this group, we had one message. We are strong because we are all on the same level. Dementia unites people. No matter if the bank director, the manager, the journalist, the housekeeper, or the shop assistant, or the translator are sitting in that group, we are all the same. It gives you a feeling of strength, of solidarity, and you know, humor is a part of our life. We are at the beginning of dementia. It is a long way. It's a long road we have to go. It's a winding road with a little bit up, but mainly down, down, down. We are realistic. We know in dementia you never go up. You can stay for some time. And you can stay for a long time at a certain level, if you get included. We got included. I got included in this wonderful self-supporting group. People who are cheering, who are leading, who are caring for the group. There isn't a specific term, you know, because the role of that person is every time different. She or he adapts to the person. There are topics, but if there is something special on that day, they adapt, they change the plan. And we change the position. Now, the lady in charge is in the front, and after half an hour, we change places. We go in the front. We are the group. We are leading the group. This is actually the first step to show you you are still valuable. I heard today, I listened to a very, very interesting speech about the meaning in dementia. There is a meaning, you know, in everything in life. And I'm convinced dementia has a meaning, and this meaning is mainly for you. All the others who are not touched by dementia, all the others who have to reflect about themselves. What are priorities in my life? How would I like to get included? Suppose I get once a diagnosis. You are amazed to see people like me or like the others. You had the chance to listen to many of my friends during the different sessions. I must say, we are brilliant. And now you may clap your hands. I was lucky. I felt wonderful in that group. My depression faded. I was always happy when this day came to meet the group. I got involved in planning. I got even the offer to candidate in the board of Alzheimer Munich. Just in parenthesis, it is the oldest Alzheimer society in Germany. We had the jubilee last year, 25 years. We are a well-known, a very appreciated group. The people who work there do their best. I candidated, I got elected, and I'm on the board. That happened March 2010. From that very moment, Germany knew people with dementia are not only the ones with lacking abilities. I'm working like the others in the group. I have a job. My job in the group is, no, I forgot the word, listen there. To make a kind of public, to present in the public our group. Give me the right word, please. Public relation, yes. Thank you, Nancy, and all the others. And I thought all my experience, I also had the other kind of experience with obstacles in a society. I was a person who had worked. Of course, I wouldn't be able to work in my former job. My computer skills are way, my languages are way, but I could talk. I could sit on the phone. I could lay a table in old people's home, and I wanted to work. It it's quite hard. There aren't any plans yet for the younger people. It is, I think, a future challenge, not only for Germany, but for all Europe, to see what happens to these people diagnosed at an early age. I wrote about my thoughts about the people I met at that time, a book. The book was published last year, and it is called Stepping Out of the Shadow. Why, subtitle, Why I'm a Strong Advocate for the Rights for People Touched by Dementia. With this book, I'm on tour. I feel myself like a dementia star who is on tour. At least 3 times a week, I'm somewhere in Germany. How do I manage, you would ask? Somebody looks at me, I know what you are thinking. I myself wouldn't manage. You know, we get a special gift when touched by dementia. We look at someone and know your thoughts, so be careful. And I have to confess, I can manage only with the people who support me. That is my son, that is the Alzheimer Society, my friends who make the route, buy the ticket, bring me to the station, pick me up from the airport, somebody is waiting there, bringing me to the hotel. I feel fine. I'm not crying that I can't do that alone. See it positive. It's the best way, most comfortable. Somebody is caring for you all the time. And with this message, I'm campaigning in Germany. My title is Involving People with Dementia. The first step to talk about involving is awareness in the society, is a plan, a strategic plan that shows, besides information about the different types of dementia, a plan that includes us to change things, a plan that actually emphasizes the importance and the role of those for whom something has to be changed. This is the first step. Of course, another important step is the early diagnosis. I attended as many conferences as possible during these days. I heard different versions. Should we tell the patient at once the diagnosis? If it's a very early diagnosis, how is the life going to change? Or should we wait some years and tell it when here the symptoms are clear as daylight? From my experience and from the experience of our European working group that was founded just, I think, 2 days ago, you know, the earlier the diagnosis is put, the better we can have new guidelines in our life. We set new priorities. We can be talked to, listen to us now. We want to tell you how we would like to live in what kind of old people's home when the final stage is coming. Listen to us now. Don't put us there without asking us. I have the chance to speak in front of psychiatrists and neurologists. They listen to me. Some are amazed and say, how is it possible? And I tell them what I'm telling you. The pills, the medicine are a part that shouldn't be neglected, but the rest is the non-pharmaceutical, the aspect what you are doing, how you keep active your life, how you are included by society, how people meet, how people integrate me. And these together make the new type of patient. A patient that likes to be talked to. Talk to me and don't talk to my relative. This is me sitting in front of you, Mr. Doctor. I speak in front of young people, students who are going to be young doctors, who are going to be carers, working in hospitals, and they are very interested. They have questions. They are amazed. I speak in different parts of Germany. I can't now remember how many states we have, but in different parts, in the north, in the south, and so on. And there are so-called local strategies, Dementia Week. And I feel honored if I'm the first to open such a Dementia Week. You know why? Not because it's Helga, no. Because dementia with a positive aspect, with the existing capabilities, is here to greet you, to show you it's a beginning. And we like to have programs to keep this state. We like to get involved. First, I can remember well, Sabine Henry from Belgium at one of the conferences of Alzheimer Europe. I was so sad. I was so feeling very, very little, very small, you know. I heard the others translating what I did once. I sat there, I couldn't almost understand. And we always need people to push us, to believe in us. It doesn't cost money. Politicians can't substitute a person. And after some years, we met again. I'm grateful that such a person like her exists. And I know there are many more. I met many more. Sometimes I forget the names, but I know what they did, because emotion will always stay in our heart. If you forget what was yesterday, who is that? But the way how you behaved to me, how you talked, how you smiled to me, how you shook my hand, I won't forget. I had the privilege to be at other conferences of Alzheimer Europe as a speaker in a small, what was it, not plenary like here, a bit smaller in Warsaw. Maybe Warsaw is present today. Don't see it as negative, but I remember it was very small. I was sitting on that chair, the lights were on my head, and I could never see the people. They saw only me, but important is the contact. I never sit when I talk to someone. I'm always on, and I usually have the microphone in my hand, and I'm moving all the time. We are active. Dementia is a disability. But it is a disability which can't be noticed at the beginning. You see us, we are not sitting in the wheelchair. We are hearing. We are seeing properly. We don't have heart problems, no diabetes. We have just dementia. And this is a point that isn't considered sufficiently in including us in so-called post-diagnostic programs. That means programs in which you foster the existing abilities and you practice them again and you even try to learn something. Dementia doesn't exist only in Europe. Dementia is all over the world. I have friends in Nepal. I have friends in Africa, in India, all over the world. There is a difference. There is still a difference. The way humans cope with dementia. Sometimes I say it frankly at interviews, I wish I was living the time when I was a little child, about 50, 55 years ago, in a big family, somewhere in the countryside, with a garden, with animals. Everything was okay. No depression. I mean, no mental. No, not having time. People had time. People were caring and caressing you. We can't change an industrial society. I'm realistic enough. But my message today is also reflect about yourself. See our being as a chance for you to reflect what should be changed, what can be done. My voice and our voice got stronger. Yesterday, this wonderful European working group of people with dementia chose a chairperson and 3 vice chair. People who have a function now. We are proud to have been elected to be the voice. We take it very seriously. We are working like you in an office, but we are not able to write on the computer. We have to learn here, writing and marking. These are the notes, because we do it by ourselves, and we like to do it. And if we need help, be sure we ask for it. Don't overrule us. That's also a point of how getting involved. And these people, all of us, have a message. Be aware of the different types of dementia. Include us. Never forget, we are a part of society, no matter where we live. And in this way, we start with a changing perception to the changing policy in dementia. And that was actually the big title of this conference. Thank you so much.